Hello, everyone. Thank you for having me. My name is Crystal Burke. I'm a nurse practitioner and a menopause specialist. So let's start with a hypothetical situation. A woman comes to me at age 43. She hasn't slept more than 4 hours in the last 2 years. Her heart races, her brain is foggy, and she's anxious. She's seen doctor after doctor and heard the same thing over and over again. Your labs are normal. You're just stressed. She leaves every visit thinking that she is the problem. It's all in her head. But it wasn't. It's perimenopause. Perimenopause is something that clinicians were not taught to look for. No one is looking for that. And she's one of millions. But in that situation, there are two people trapped here, the patient and the clinician. Like I said, most clinicians were never taught menopause at all, much less perimenopause. And even if they were trained in perimenopause, the care that's needed for perimenopause does not fit a 15-minute visit, which is a traditional office visit. What's needed is months of patient education, dose adjustments, and follow-up. At the same time, many clinicians are leaving traditional insurance-based practices. They want to open private, direct care practices where they can practice the way that they want to and the way that's most helpful for the patients. But they hit a wall. Who does all the work in between the visits? What about refills, follow-ups, phone calls, the education? The only answer is usually to hire a team, but for most, that's where the dream ends. In that, the patient has failed and the clinician is trapped. I was that clinician. I'm Crystal Burke, a nurse practitioner and menopause specialist. So I opened up a clinic a year ago. The real problem that I found after opening up the clinic was that it's not just access to good clinicians, it's all of the things that go into an operating system behind the office visit. I could buy software that documents a visit, stores information, and bills a patient, but none of them run the care. So I built what I needed. Vespyra. It's a care delivery operating system for women's health. A clinician speaks a decision, like start Jane on estradiol, recheck labs in 6 weeks, send her the titration education. Vespyra turns it into the note, the plan, the reminders, and the follow-up, all done within 10 seconds. An electronic medical record records the care. Vespyra delivers it, with the clinician making every clinical decision, and the system carries out the operations, not the medicine. One clinician can now provide the continuous care that used to take a whole team. And here's where it matters most. In a traditional practice, a woman starts treatment and waits 3 months. There may be a wrong dose, side effects, there may be no improvement, and she just waits. On Vespyra, the weeks in between care are the care. She's tracked, educated, and followed completely. The system flags system events, whatever needs attention. Adjustments can happen earlier. Same patient, same clinician, completely different experience. And this isn't theoretical. Vespyra runs my clinic every day. I have more than 100 active members, grown entirely by word of mouth, 93% annual retention rate, 0 spent on acquisition, and 96% engaged patients improved within 3 months. Menopause is the wedge, but the opportunity is a lot larger. Perimenopause starts in the late 30s, when women are raising families, advancing their careers, and should be at the top of their game. And the same problem runs across all of women's chronic care: thyroid, endometriosis, cardiovascular, and bone health. We've proven the model exists in menopause. We want to expand it by adding a new module. It wouldn't be a new company, a new module under the same. The founder market fit isn't a story, it's a built history. I am a clinician who needed this, so I built it and I run on it every day. I'm supported by Stephen Youngblood, an internal medicine physician who is the co-founder of the medical clinic in New Orleans and also acts as a clinical advisor for Vespyra. So now that we've proven the model, what we're building is the next version that any clinician can run. What we're looking for isn't just capital, it's the right technical leadership and advisors. And the first pilot clinicians to take this beyond my practice. The capital would fund the build, a lean round, about $220,000, but we aren't starting from scratch. But what we really need is people to accelerate the mission. Vespyra gives clinicians a way out of the system that burned them out, and a way for women to have the care that they should have had all along. Thank you. Questions? Yeah. Mm-hmm.
Thank you very much. So you mentioned that currently your clients are 100% word of mouth, right?
I'm sorry?
Word of mouth currently.
Yes. Okay. Yes, word of mouth, yes.
So as you are moving forward and you are moving to like multi-tenant SaaS model, what's your commercial strategy? What's your road to market strategy? And what's the projected acquisition cost?
So the patients for the menopause clinic, which is the first client of Vespyra. But let me put this up a little so you can see. Wrong way. There we go. Okay. So when I was looking for systems, what I found, like electronic records will record the data. I couldn't find anything to help with the actual operating. But there are electronic health records that would be great partners with this. So as I said, also there is a lot, the actual customer would be physicians. In 2023, there were 200 direct care practices, just private practices run by physicians. In the last couple of years, it's gone from 300 to 2,000. And it is continuing to rise. That would be our customers. So just to give you an example, I am in a group of 22,000 providers who one of the biggest things that they're looking for is help with one of the functions that we do, refills. How do you keep track of refills? Because the way that most physicians' offices do this is by hiring a staff. So how do you do that without? I have not been able to find a way, which is why we did this. But the actual, to answer your question, make sure, the actual customer would be the clinician.
What is your... Oh, What does your competitive landscape look like? A similar question to that's been asked already is just like IP around this. What stops people in the age of AI from coming up with something very similar to you and just have deeper pockets?
Yeah. So almost everything. And actually, so there's only a very few, I think there's maybe two. Everything revolves around insurance-based care. Which is a completely different model. If someone were to do this under insurance-based care, it would not be paid for. It would not be covered. That's why the customer would be a private provider. So kind of looking at what we have out there now, we have virtual menopause clinics, and that is not the system. That is just them taking the patients. AI scribes. So in any of this too, one of the things to know is this isn't AI. It's a workflow and a new model, a completely different platform. So the AI that we have now in healthcare is scribes. So I see a patient, again, visit-based, completely visit-based. So the ambient listening will listen and does an amazing note. But again, visit-based. So it's a completely different system. Some of the other things, we do have two that I know of that do cater towards direct primary care, and they do membership billing and nothing with the operating system. It would be a completely different train of thought and a completely different way of doing things. So it could happen, but it hasn't yet, that I can find.
Okay, thank you to Crystal Burke and Vespyra.